Hello, and welcome to celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the celiac.com forum at www.celiac.com. And now, let's move on to more celiac.com news. Debunking common myths about gluten sensitivity. Gluten sensitivity has been a topic of growing concern and discussion over the past decade, especially with the rise in awareness about celiac disease and non-celiac gluten sensitivity, NCGS. However, along with this increased attention, there has also been a rise in misinformation. This article seeks to debunk some of the most common myths surrounding gluten sensitivity, offering clarity for both newly diagnosed individuals and those already familiar with the condition. Myth 1. Gluten sensitivity is the same as celiac disease. One of the biggest misconceptions is that gluten sensitivity and celiac disease are interchangeable terms. While both involve adverse reactions to gluten, the two conditions are fundamentally different. Celiac disease is an autoimmune disorder where ingesting gluten causes the immune system to attack the small intestine, leading to inflammation and damage to the villi, tiny hair-like projections that absorb nutrients. This damage can result in serious health issues, including malnutrition, osteoporosis, and even certain cancers. On the other hand, non-celiac gluten sensitivity, NCGS, does not involve an immune system attack or intestinal damage. Individuals with NCGS may experience symptoms such as bloating, diarrhea, or headaches after consuming gluten, but there is no evidence of an autoimmune response. This distinction is critical because it affects how the two conditions are diagnosed and managed. For instance, celiac disease requires a strict, lifelong gluten-free diet, while the necessity of this for NCGS patients is still debated and may vary from person to person. Myth 2. Gluten sensitivity is just a trend or fad. Another pervasive myth is that gluten sensitivity is simply the latest health fad, with many people going gluten-free unnecessarily. While it's true that the gluten-free diet has become popular among those without gluten-related conditions, non-celiac gluten sensitivity is a legitimate medical condition recognized by experts. Research shows that individuals with NCGS may experience symptoms after consuming gluten that are not attributable to celiac disease or wheat allergy. However, diagnosing NCGS can be challenging since there are no specific biomarkers like there are for celiac disease. As a result, many people assume that gluten sensitivity is merely a self-diagnosed trend when, in fact, it is a real issue for a significant number of individuals. It's important to separate the cultural phenomenon of adopting a gluten-free diet as a lifestyle choice from the medical necessity some individuals face due to gluten-related health issues. A 2016 study estimated that 0.5 to 6% of the population may have NCGS, which shows that it's more than just a passing trend. Myth 3. Gluten sensitivity is always permanent. Many people believe that once you develop gluten sensitivity, it's a permanent condition, similar to celiac disease. However, some individuals with NCGS may not need to avoid gluten for life. Research is still ongoing, but some evidence suggests that gluten sensitivity could be transient for certain people, meaning they may be able to reintroduce gluten after a period of avoidance without experiencing symptoms. It is also possible that the initial symptoms of gluten sensitivity may have been triggered by other factors such as stress, infections, or changes in gut microbiota. Once these underlying factors are addressed, the individual's tolerance to gluten might improve. Nonetheless, anyone considering reintroducing gluten should do so under the guidance of a healthcare provider. Myth 4. You can self-diagnose gluten sensitivity. In the age of internet research and online symptom checkers, many individuals attempt to self-diagnose gluten sensitivity. However, this can be problematic for several reasons. First, the symptoms of NCGS often overlap with those of other conditions, such as irritable bowel syndrome, IBS, wheat allergy, or celiac disease. To avoid misdiagnosis, it's essential to consult a healthcare professional who can rule out celiac disease and other conditions through appropriate testing. In fact, many people who believe they have gluten sensitivity may actually have celiac disease but are unaware of it. If someone removes gluten from their diet without first being tested for celiac disease, it becomes much more difficult to accurately diagnose the autoimmune disorder later on. Moreover, following a gluten-free diet unnecessarily can lead to nutritional deficiencies. Gluten-containing foods are often high in essential nutrients like fiber, iron, and B vitamins, and cutting them out without proper guidance could lead to poor dietary balance. Myth 5. All gluten-free products are healthy. Another widespread myth is that gluten-free automatically equals healthy. While gluten-free products are essential for those with celiac disease or NCGS, they aren't inherently healthier than their gluten-containing counterparts. In fact, many processed gluten-free foods are made with refined starches such as rice flour or tapioca starch, which can lack essential nutrients and fiber. Some gluten-free products may also be higher in sugar and fats to compensate for the absence of gluten, resulting in a less nutritious alternative. For those on a gluten-free diet, it's crucial to focus on naturally gluten-free whole foods, such as fruits, vegetables, lean meats, and gluten-free grains like quinoa or brown rice, rather than relying solely on processed gluten-free products. This ensures that the diet remains balanced and nutrient-rich. Myth 6. Gluten sensitivity only affects digestion. While digestive symptoms like bloating, diarrhea, and abdominal pain are the most commonly associated with gluten sensitivity, the condition can affect much more than just the digestive system. Many people with NCGS report non-digestive symptoms such as headaches, brain fog, joint pain, fatigue, and even skin issues. These extra-intestinal symptoms can make it more challenging to diagnose gluten sensitivity as they overlap with other conditions and are often not immediately linked to gluten consumption. Therefore, if someone experiences a range of unexplained symptoms that improve on a gluten-free diet, gluten sensitivity could be a possible culprit. Conclusion: gluten sensitivity, particularly non-celiac gluten sensitivity, is a real and complex condition that affects many people. It's essential to debunk the myths surrounding gluten sensitivity to ensure that individuals receive accurate information and proper care. While gluten-free diets are crucial for those with celiac disease and NCGS, they shouldn't be adopted lightly without consulting a healthcare provider. By understanding the differences between gluten-related conditions, recognizing the legitimacy of NCGS, and being mindful of nutritional choices, people can make informed decisions about their health and well-being. Whether you're newly diagnosed or have been managing gluten sensitivity for years, staying educated is the key to living well. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in, and see you next time.